I think just making sure that the pay that you agreed on is correct. Obviously, that's kind of obvious, but
Yeah.
yeah, and negotiating pay is kind of hard.
Yeah.
But
And I think that's, I mean, it's obvious to us, but some people don't realize like something that you verbally agreed on may not always make it to the actual contract. So like you do need to read the contracts. I guess that's like number one. You need to read
it,
the
or have your dad read it, or your husband, or whatever.
Yeah.
Like, have another person look at it with you if you don't really know what you're looking at. Like I didn't really know.
Yeah.
Especially when I first started. Pay. I always put, like I said, like the dates that I wanted off during the contract written down so that they couldn't mess with you. Because you can't really break the contract.
Yeah.
And I would always ask for a week, whether it was over a holiday or just a random week, just like a Wednesday to a Wednesday, so that I could still work a full week in the front end and the back end. Floating policy, like that's something I never really thought of to add until I got floated to adults. But if you're like a peds nurse and you don't want to float to adults, like you could ask to put it in your contract.
Yeah.
Especially if it's something that you talked about with the manager during the interview.
For sure.
Like I've talked about that in interviews, like, oh, where would I float if I had to float? And they would say like, oh, the PICU, the CVICU, it's all peds, you know, or mother baby, something like that. And you would just do the babies. So I would always ask, but then I just assumed, oh, so we're good. But I think having it in your contract, it doesn't hurt.
It doesn't hurt. And I mean, honestly, if they have verbally said it, then there should be no problem putting it in the contract.
Exactly.
You know? I got burned once. I think I had agreed to a day position and then I signed the contract without, I just overlooked the rotation requirement and I was working nights and days and I was like, but I was I had signed it. So then I think I talked to the manager about it and I was like, if this is what you need, you know, I'm here to help out the unit, I guess that's fine. But I just, like, we had talked about days. Right. And so I think she had ended up maybe putting me on more days than nights. But like that, you know, I had nobody to blame but myself. I didn't read the contract. Yeah. So definitely
read the contract for sure. Another thing I thought of is cancellation policy. I don't know if you've ever gotten like canceled, but I worked at one unit that was like 10 beds. So we usually had maybe 5 patients, sometimes one. And they need one nurse to take care of the baby. And then they would have one other nurse for an emergency. Yeah. So first to cancel is travelers. So I think just always putting that in your contract, like one time per 2 weeks or something like that, so that you're not being canceled every single day. Yeah. Because what's the point?
There's it's important to know what is in your contract in regards to canceling, because some hospitals will never cancel travelers because they assume that they're going to get paid regardless, but they actually don't know. In the contracts a lot of times it says, you know, you can cancel a traveler like, you know, once every 2 weeks or something. Yeah. So I don't think I have ever gotten burned that way. I think that people just automatically assume that I'm going to have to get paid regardless. So they'll just, you know, float me wherever. I was always in larger units, I feel like. So yeah, somebody needed me in the hospital. Exactly. but yeah, I do have friends that, you know, they would just cancel them whenever their contract allowed them to be canceled. Yeah. And like, you know, that's...
And usually I think you have to work the full 36 hours a week to even get your stipend. Yeah. So... Yeah, it burns especially if your hourly is like super low, like if you're making $20 an hour, but you miss out on your stipend, that's a huge chunk of money that you're missing out on. So yeah, I think it's important to cover yourself that way.
For sure. Also, I think that if you're traveling, if you are staying at home on the off days that you're not working, you can also ask in the contract to be to work like 3 in a row or something like that. That you can negotiate that in your contract sometimes.
Yeah.
Like, you know, I knew a woman who I think lived in like South Carolina or something, and she would drive 5 hours north to do her assignments. She would stay in a hotel for 3 days and then she would go home.